10 medical emergencies. Diabetes. The pancreas is a vital organ in the abdominal region that manufactures and releases insulin into the body. This insulin allows sugar into the cells. We receive our sugar from the food we eat. When there is a decreased production of insulin, it will not allow the sugar in the blood to break down and enter the body's cells to give us energy. This condition is known as diabetes mellitus. Hyperglycemia results from a decreased insulin supply. The body is not producing enough insulin, or the person is not taking their proper dosage of insulin. The casualty is in a high blood sugar state. This is a slow onset. Hypoglycemia occurs when there is too much insulin in the body. This is a result of the person taking too much insulin, has reduced sugar intake or has overexercised, allowing faster sugar absorption than normal. The casualty is in a low blood sugar state. This is a rapid onset. Signs and symptoms. Low blood sugar. Rapid onset. Hunger. Irritable. Confused. Shaky. Cold, clammy skin. Possible seizures. High blood sugar. Slow onset. Thirst. Nausea. Dry, warm skin. Drowsy. Frequent urination. Fruity smelling breath. Management. Scene survey. Primary survey. Secondary survey and ask the 3H questions. Look for a medical alert bracelet/necklace. Glucose tablets are the preferred treatment for hypoglycemia where the person is awake, able to respond and swallow. Less effective but acceptable forms of sugar can also be used in the absence of glucose tablets. Give lots of sugar. If no improvement in 10 to 15 minutes, activate EMS. When in doubt, start with sugar. Allergies and anaphylactic shock. People react to foreign substances differently. When the body is sensitive to a foreign substance, it may cause an allergic reaction. Reactions can be mild or may be life-threatening like anaphylactic shock. Causes. Insect stings/bites. Ingested substances. Inhaled substances. Injected substances. Absorbed substances. Signs and symptoms. Itching, hives. Dizziness. Nausea. Difficulty breathing. Headache. Signs of shock. Management. Scene survey. Primary survey. Look for a medical alert bracelet/necklace. Monitor vital signs. Locate casualties. Medication. Casualty may need a second dose of epinephrine if the first dose is not effective after 5 minutes. Activate EMS if necessary. Secondary survey and ask the 3H questions. Ongoing care and treat for shock. Asthma. Asthma is an inflammatory disease that occurs when the air sacs of the lungs become narrowed and there is an overproduction of mucus. These complications severely restrict airflow, causing breathing difficulties. Prevention. Control of stress. Environmental pollutants. Allergies. Signs and symptoms. Shortness of breath/wheezing/coughing. Tightness in chest. Cyanosis. Anxious. Management. Scene survey. Primary survey. Look for a medical alert bracelet/necklace. Locate casualties. Medication. Rest casualty. Get the casualty to breathe in through the nose and out through the mouth. Activate EMS if problems persist. Convulsions and seizures. Seizures are caused by an electrical or chemical imbalance in the brain, which may be due to injury, disease, fever, poisoning, or infection. This irregular activity may cause the body to have uncontrolled muscular contractions. Seizures may be caused by a condition called epilepsy, which is usually controllable with medication. Some children and infants have seizures that are caused by a sudden high fever. Causes. epilepsy or other medical condition, high fever or drastic temperature change, drugs/alcohol overdose, stroke, brain injury, diabetes, low sugar, photogenic, strobe lights, audiogenic, thunder, poisoning, stress, non-convulsive seizures, non-responsive, trembling, drooling, daydreaming, blinking, management, scene survey, primary survey, secondary survey, stand by and monitor vital signs, call EMS, convulsive seizures, possible aura, warning the casualty that a seizure is about to occur, level of consciousness, causing casualty to fall, casualty becomes rigid, possible loss of bladder or bowel control, frothing at mouth, management, scene survey, clear the area and make area safe, protect casualty's head with pillow or blanket or your thighs. Do not attempt to restrain the casualty or put anything in the casualty's mouth. Roll casualty into the recovery position when seizure has ended, allowing fluids to drain and to maintain an airway. Cover casualty with a blanket or jacket. Ongoing care and treat for shock. Allow casualty to rest afterwards. Call EMS.